Welcome to the NHA Phlebotomy Exam Study Guide, your path to NHA certification. Whether you're just starting your journey in phlebotomy, looking to sharpen your skills, or preparing for your NHA certification, this is the perfect place to start. In this video, we'll cover all the essentials of phlebotomy, including best practices, practical techniques, and exam tips to ensure you're fully prepared. After each chapter, we've included a Q&A section to help solidify your understanding. For the ultimate prep experience, check the description to access the Audible version, the free exam prep guide, or the Amazon link for the book. Don't forget to like and subscribe for more exam resources and updates. Now, here's your instructor to guide you on this path to certification.
Number 1. Which of the following is the most important practice to prevent the spread of infection? A. Wearing gloves only. B. Regular equipment cleaning. C. Proper hand hygiene. And D. Using clean needles only. The answer is C. Proper hand hygiene. Number 2. What is the primary purpose of wearing personal protective equipment, PPE? A. To protect the patient. B. To look professional. C. To protect the phlebotomist from exposure to pathogens. And D. To satisfy workplace policies. The answer is C. To protect the phlebotomist from exposure to pathogens. Number 3. Which agency is responsible for regulating the disposal of wastes and sharps? A. OSHA. B. FDA. C. CDC. D. EPA. The answer is A. OSHA. Number 4. Which of the following is a crucial step in maintaining a sterile field during phlebotomy procedures? A. Talking with the patient to distract them. B. Using the same needle for multiple tubes. C. Disinfecting the puncture site properly. Or D. Recapping needles after use. The answer is C. Disinfecting the puncture site properly. Number 5. In which scenario is it necessary to use a safety needle? A. When the patient is a child. B. When drawing blood from a vein. C. When dealing with a combative patient. Or D. In all blood collections to prevent needle stick injuries. The answer is D. In all blood collections to prevent needle stick injuries. Number 6. What should be done immediately if a phlebotomist is exposed to a needle stick injury? A. Wash the area with water only. B. Continue with the procedure and report later. C. Wash with soap and water, then report the incident. D. Cover the area with a bandage only. The answer is C. Wash with soap and water, then report the incident. Number 7. What is the primary purpose of the bloodborne pathogen standard? A. To protect healthcare workers from exposure. B. To identify infected patients. C. To monitor needle usage. And D. To ensure proper disposal of phlebotomy equipment. The answer is A. To protect healthcare workers from exposure. Number 8. Which solution is commonly used as a skin antiseptic before blood collection? A. Alcohol. B. Hydrogen peroxide. C. Bleach. Or D. Iodine. The answer is A. Alcohol. Number 9. Which tube should be drawn first in a multi-tube blood draw? A. Heparin tube. B. EDTA tube. C. Serum separator tube. Or D. Blood culture tube. The answer is D. Blood culture tube. Number 10. How long should a tourniquet be left on the arm during venipuncture? A. 1 minute. B. 5 minutes. C. 2 minutes. D. As long as needed. The answer is A. 1 minute. Number 11. What is the proper angle for a needle insertion during venipuncture? A. 15 to 30 degrees. B. 45 degrees. C. 90 degrees, or D. 60 degrees? The answer is A. 15 to 30 degrees. Number 12. Which vein is commonly used for venipuncture? A. Basilic vein, B. Median cubital vein, C. Cephalic vein, D. Brachial vein. The answer is B. Median cubital vein. Number 13. What should a phlebotomist do if a patient refuses a blood draw? A. Proceed anyway. B. Convince the patient. C. Inform the patient's healthcare provider. Or D. Restrain the patient. The answer is C. Inform the patient's healthcare provider. Number 14. Which tube is used for coagulation studies? A. Blue, B. Red, C. Green, or D. Yellow? The answer is A. Blue. Number 15. How many times can a needle be used before disposal? A. Once, B. Twice, C. 3 times, D. As long as it's not damaged. The answer is A. Once. Number 16. What information must be included on a blood specimen label? A. Patient's full name and date of birth, B. Phlebotomist's initials, C. Date and time of collection, D. All of the above. The answer is D. All of the above. Number 17. What is the appropriate action if a patient faints during a blood draw? A. Continue the blood draw. B. Lay the patient down and elevate the legs. C. Offer the patient water. Or D. Leave the patient to seek help. The answer is B. Lay the patient down and elevate the legs. How should the phlebotomist dispose of a needle used in a blood draw? A. Recap and place it in the regular trash. B. Immediately place it in a sharps container. C. Disassemble, then dispose of it. D. Sterilize and reuse. The answer is B. Which of the following tubes should be inverted immediately after blood collection? A. Serum separator tube, B. EDTA tube, C. Sodium citrate tube, D. All of the above. The answer is D. All of the above. Number 26. When performing a heel stick on an infant, what is the maximum allowable depth of the puncture? A. 1.0 millimeters, B. 2.0 millimeters, C. 3.0 millimeters, or D. 4.0 millimeters. The answer is B. 2.0 millimeters. Number 27. When is it necessary to perform hand hygiene? A. Only after glove removal. B. Before and after patient contact. C. Only when the hands are visibly dirty. And D. Only after patient contact. The answer is B. Before and after patient contact. Number 28. Which organization sets guidelines for phlebotomy procedures? A. FDA, B. OSHA, C. CLSI, and D. CDC. The answer is C. CLSI. Number 29. Which of the following is a phlebotomist allowed to do? A. Start an IV line. B. Administer medications. C. Collect blood specimens. Or D. Order laboratory tests. The answer is C. Number 30. Where should a tourniquet be placed during venipuncture? A. Above the elbow. B. Just above the wrist. C. Anywhere on the arm. Or D. On the forearm. The answer is A. Above the elbow. Number 31. What is the purpose of an anti-glycolic agent in a blood collection tube? A. It prevents the breakdown of glucose. B. It accelerates clotting. C. It preserves red blood cells. Or D. It prevents coagulation. The answer is A. It prevents the breakdown of glucose. Number 32. What should be the phlebotomist's course of action if a patient's vein collapses during a blood draw? A. continue the draw from the same site. B. Try another site or vein. C. Use a larger needle. Or D. Ask the patient to come back later. The answer is B. Try another site or vein. Number 33. Which test requires a strict aseptic technique? A. Glucose. B. Blood culture. C. Complete blood count, CBC. Or D. Cholesterol. The answer is B. Blood culture. Number 34. Which information is essential when labeling a patient's specimen? A. The name of the physician. B. The location where the draw took place. C. The phlebotomist's full name. And D. The time and date of collection. The answer is D. The date and time of collection. Number 35. What is the recommended depth for a finger stick? A. 1 millimeter. B. 2 millimeters. C. 3 to 4 millimeters. Or D. 4 to 5 millimeters. The answer is B. 2 millimeters. Number 36. How should uncollected specimens be labeled? A. With a canceled label. B. With the reason for not collecting. C. They should not be labeled. And D. With the patient's name and date. Number C. They should not be labeled. Number 37. How many identification checks should be performed before starting a blood draw? A. 1. B. 2. C. 3. Or D. 4. The answer is B. 2. Number 38. What is a common complication of a finger stick? A. Hematoma. B. Infection. C. Scar formation. And D. Excessive bleeding. The answer is A. Hematoma. Number 39. Which type of specimen requires chilling immediately after collection? A. Glucose. B. Blood culture. C. Ammonia. Or D. Hemoglobin. The answer is C. Ammonia. Number 41. How should needles be disposed of after use in a blood collection? A. In a biohazard bag. B. In a sharps container. C. In a recyclable container. And D. In a regular waste bin. The answer is B. In a sharps container. Number 42. Which of the following is a symptom of shock? A. Hypertension. B. Flushed skin. C. Decreased heart rate. Or D. Rapid weak pulse. The answer is D. Rapid weak pulse. Number 43. Which color tube is used for a CBC, a complete blood count? A. Lavender. B. Green. C. Blue. D. Red. The answer is A. Lavender. Number 44. What is the correct procedure after a needle stick injury? A. Wash with soap and water. Seek medical attention. B. Clean with alcohol swab. Continue working. C. Wash with water only. Continue working. And D. Ignore and continue the procedure. The answer is A. Wash with soap and water. Seek medical attention. Number 45. Which tubes should be drawn last in a venipuncture procedure? A. Additive tubes. B. Blood culture tubes. C. Serum tubes. D. Coagulation tubes. The answer is C. Serum tubes. Number 46. Which of the following can result in hemoconcentration? A. Prolonged tourniquet application. B. Excessive mixing of tubes. C. Short tourniquet application. And D. Using a large bore needle. The answer is A. Prolonged tourniquet application. Number 47. Which of the following is the smallest vein that can be used for venipuncture? A. Cephalic vein. B. Basilic vein. C. Vena cava. And D. Median cubital vein. The answer is A. Cephalic vein. Which additive is present in a blue top tube? A. Heparin. B. EDTA, C. Citrate, and D. Gel separator? The answer is C. Citrate. Number 49. What should be done if a patient has a syncope reaction during a blood draw? A. Continue the draw, then address the reaction. B. Stop the draw, remove the tourniquet, and lower the patient's head. C. Finish quickly to allow the patient to recover. D. Leave to get help, leaving the patient alone. The answer is B. Stop the draw, remove the tourniquet, and lower the patient's head. Number 50. What is the most appropriate site for capillary collection on an adult? A. Tip of the finger. B. Earlobe. C. Heel. D. Ring finger. Number 51. How is a tourniquet properly applied? A. Tightly, cutting off circulation. B. Loosely, allowing free movement. C. Snugly, allowing the vein to fill. D. Loosely, above the elbow only. The answer is C. Snugly, allowing the vein to fill. Number 52. What is the primary reason for mixing tubes immediately after collection? A. To prevent clotting in serum tubes. B. To ensure mixing of the additives with the blood. C. To prevent hemolysis. And D. To cool down the specimen. The answer is B. To ensure mixing of additives with the blood. Number 53. What is the risk associated with a hematoma during venipuncture? A. Infection. B. Nerve damage. C. Scarring. D. Loss of consciousness. The answer is B. Nerve damage. Number 54. Which of the following would lead to a rejection of a blood specimen? A. Hemolysis. B. Mislabeling. C. Inadequate volume. Or D. All of the above. The answer is D. All of the above. Number 55. Which fingers are the most suitable for capillary puncture? A. Index and middle fingers. B. Ring and pinky fingers. C. Middle and ring fingers. Or D. Index and ring fingers. The answer is C. Middle and ring fingers. Number 26. What action should a phlebotomist take if a patient is found to be allergic to latex? A. Proceed as usual. B. Use vinyl or nitrile gloves. C. Use powdered latex gloves. Or D. Cancel the procedure. The answer is B. Use vinyl or nitrile gloves. Number 57. In which order should the phlebotomist collect blood samples from multiple sites? A. From the most difficult to the easiest. B. From the easiest to the most difficult. C. Based on patient preference. Or D. Random selection. The answer is B. From the easiest to the most difficult. Number 58. What role does patient identification play in phlebotomy? A. It's optional, not critical. B. It helps in labeling only. C. It is essential for patient safety and accurate results. D. It's required by law, but not necessary. The answer is C. It is essential for patient safety and accurate results. Number 59. What is an appropriate method to prevent patient identification errors? A. Asking the patient to state their name. B. Calling the patient by name and waiting for a response. C. Checking the patient's bed number. Or D. Asking the patient to confirm their doctor's name. The answer is A. Asking the patient to state their name. Number 60. Which of the following is essential to maintain the integrity of a blood specimen? A. Proper labeling. B. Appropriate storage conditions. C. Correct order of draw. Or D. All of the above. The answer is D. All of the above. Number 61. What is the proper angle for needle insertion during a venipuncture procedure? A. 15 to 30 degrees. B. 30 to 45 degrees. C. 45 to 60 degrees, or D, 60 to 75 degrees? The answer is A, 15 to 30 degrees. Number 62. Which of the following veins is most commonly used for venipuncture? A, basilic vein, B, cephalic vein, D, median cubital vein, or D, radial vein? The answer is C, median cubital vein. Number 63. Which of the following is best practice for preventing infection during phlebotomy procedures? A, wearing gloves only. B, hand washing and wearing gloves. C, using hand sanitizer only. And D, wearing masks only. The answer is B, hand washing and wearing gloves. Number 64. What is the primary purpose of an antiglycolic agent in a blood collection tube? A, to prevent clotting. B, to preserve glucose. C, to separate blood components. Or D, to prevent hemolysis? The answer is B, to preserve glucose. Number 65. What is the standard gauge of needles used in routine venipuncture? A, 18 to 19, B, 20 to 21, C, 22 to 23, or D, 24 to 25? The answer is B, 20 to 21. Number 66. Which tube is commonly used for coagulation studies? A, lavender top tube, B, light blue top tube, C, red top tube, or D, green top tube? The answer is B, light blue top tube. Number 67. Which of the following is a crucial step in the venipuncture site selection process? A, choosing the largest visible vein. B, palpating with the thumb. C, considering the patient's comfort. D, ignoring previous puncture sites. The answer is C, considering patient comfort. Number 68. What should a phlebotomist do if a patient refuses a blood draw? A, persuade the patient aggressively. B, proceed with the draw, ignoring the refusal. C, inform the healthcare provider and document the refusal. D, leave the patient without saying anything. The answer is C, inform the healthcare provider and document the refusal. Number 69. What is the recommended practice to correctly identify a nonverbal patient? A, ask a family member or friend. B, check the patient's wristband. C, guess the patient's identity. D, ask the nurse only. The answer is B, check the patient's wristband. Number 70. Which of the following additives acts as an anticoagulant by binding calcium? A, sodium citrate. B, heparin. C, EDTA. Or D, sodium fluoride? The answer is A, sodium citrate. Number 71. What is the correct order of draw in a multi-tube blood collection? A, blue, red, green, lavender. B, red, blue, green, lavender. C, blue, green, lavender, red. And D, red, green, blue, lavender. The answer is A, blue, red, green, lavender. Number 72. Which of the following is a common error in blood specimen labeling? A, including the date and time of collection. B, including the phlebotomist's initials. C, omitting the patient's middle name. Or D, misidentifying the patient? The answer is D, misidentifying the patient. Number 73. Which of the following tubes is used for blood bank collections? A, pink top tube. B, gray top tube. C, black top tube. Or D, tan top tube? The answer is A, pink top tube. Number 74. Where should the tourniquet be applied during a venipuncture procedure? A, just above the wrist. B, 3 to 4 inches above the puncture site. C, at the elbow joint. Or D, anywhere on the arm? The answer is B, 3 to 4 inches above the puncture site. Number 75. What is a phlebotomist's role in point-of-care testing? POCT. A. Only collecting the specimen. B. Both collecting and analyzing the specimen. C. No role in POCT. And D. Only analyzing the specimen. The answer is B. Both collecting and analyzing the specimen. Number 76. What precautions should be taken when drawing blood from a patient receiving IV fluids? A. Avoid drawing from the arm with the IV. B. Draw from the arm with the IV, but below the site. C. There are no specific precautions. D. Draw from the arm with the IV, but just above the site. The answer is A. Avoid drawing from the arm with the IV. Number 77. How long should pressure be applied to a venipuncture site after needle withdrawal to prevent hematoma formation? A. 1 to 2 minutes. B. 2 to 3 minutes. C. 3 to 4 minutes. D. Until bleeding stops. The answer is D. Until bleeding stops. Number 78. Which of the following specimens need to be protected from light? A. CBC. B. Electrolytes. C. Bilirubin, or D. Culture. The answer is C. Bilirubin. Number 79. How should a blood smear or blood film be prepared? A. By dropping blood onto a slide. B. By spreading blood between 2 slides. C. By placing blood in a tube. Or D. By using an automated instrument. The answer is B. By spreading blood between 2 slides. Number 80. What is the most critical factor in avoiding contamination in blood culture collections? A. Order of the draw. B. The type of antiseptic used. C. The skill of the phlebotomist. And D. The type of tubes used. Number 81. What is the purpose of performing an Allen test before arterial blood gas, ABG, collection? A. To assess for proper vein selection. B. To ensure collateral circulation. C. To choose the correct size needle. Or D. To calm the patient. The answer is B. To ensure collateral circulation. Number 82. Which of the following would most likely lead to hemolysis of a blood specimen? A. Using a large bore needle. B. Gentle mixing of the tube. C. Vigorous shaking of the tube. Or D. Proper labeling of the specimen. The answer is C. Gentle mixing of the tube. Number 83. Which of the following patients is it advised to avoid using the arm for venipuncture? A. Patients with a hematoma. B. Patients with an IV line in the arm. C. Patients who have had lymph nodes removed. Or D. All of the above. The answer is D. All of the above. Number 84. What should a phlebotomist primarily look for in selecting a venipuncture site? A. The largest vein. B. The first vein they find. C. A vein that is straight and bouncy. Or C. A vein closest to the wrist. The answer is C. A vein that is straight and bouncy. Number 85. What precautions should be taken when performing venipuncture on a patient who is taking anticoagulants? A. Apply extra pressure on the site after the draw. B. Use a smaller gauge needle. C. Avoid the procedure altogether. And D. Draw extra tubes of blood. The answer is A. Apply extra pressure on the site after the draw. Number 86. How should a phlebotomist clean a venipuncture site? A. With a back and forth motion. B. In a circular motion from the center outward. C. Randomly cleaning all areas. And D. Only cleaning the exact puncture site. The answer is B. In a circular motion from the center outwards. Number 87. Which tube should be drawn first when collecting a blood culture? A. Aerobic. B. Anaerobic. C. Either, doesn't matter. Or D. A non-blood culture tube. The answer is A, aerobic. Number 88. What is the minimum amount of time a tourniquet should remain on the arm during a blood draw? A, 1 minute. B, 2 minutes. C, 3 minutes. D, it should remain until all tubes are filled. The answer is B, 2 minutes. Number 89. Which of the following is the best choice for venipuncture in a newborn? A, median cubital vein. B, dorsal hand veins. C, heel stick. D, finger stick. The answer is C, heel stick. Number 90. Which of the following is a sign you have accidentally punctured an artery during venipuncture? A, slow filling of the tube. D, dark venous blood filling the tube. B, bright red pulsatile flow of blood. D, no blood enters the tube. The answer is C, bright red pulsatile flow of blood. Number 91. Which department in the hospital typically processes cerebral spinal fluid, CSF, samples? A, chemistry. B, hematology. C, microbiology. And D, immunology. The answer is C, microbiology. Number 92. What is the correct angle for a heel stick on a newborn? A, 90 degrees. B, 45 degrees. C, 30 degrees. And D, 15 degrees. The answer is C, 30 degrees. Number 93. In a glucose tolerance test, GTT, how many hours prior should the patient fast? A, 2 hours. B, 4 hours. C, 8 hours. Or D, 12 hours. The answer is C, 8 hours. Number 94. Which of the following tests require the specimen to be chilled immediately after collection? A, CBC. B, PT/INR. C, ammonia. Or D, lipid panel. The answer is C, ammonia. Number 95. How should a phlebotomist handle a difficult draw or hard-to-find veins? A, by probing aggressively to find the vein. B, by asking another phlebotomist for assistance. C, by ignoring the difficulty, continuing the procedure. Or D, by choosing the first vein that is found, regardless of suitability. The answer is B, by asking another phlebotomist for assistance. Number 96. What is the importance of the order of draw in phlebotomy? A, it is important for the phlebotomist's convenience. B, it prevents cross-contamination between tubes. C, it is a random sequence that can be changed. Or D, it's based on the color of the tubes. The answer is B, it prevents cross-contamination between tubes. Number 97. What does the presence of bubbles in a blood gas syringe indicate? A, the sample is well mixed. B, the sample is contaminated with air. C, the sample is ready for analysis. D, the sample is ideal for testing. The answer is B, the sample is contaminated with air. Number 98. How should the phlebotomist treat a patient who has a fear of needles? A, ignoring the fear and proceeding quickly. B, empathizing, explaining, and being gentle. C, telling the patient that the fear is irrational. D, asking the patient to leave and come back later. The answer is B, empathizing, explaining, and being gentle. Number 99. Which type of tube is commonly used for collecting an ethanol specimen? A, gray top tube. B, green top tube. C, red top tube. Or D, blue top tube. The answer is A, gray top tube. Number 100. What is the significance of a short draw or underfilled tube in coagulation studies? A, it may lead to erroneous results due to altered coagulant to blood ratio. B, it has no significant effect on the results. C, it leads to faster processing of the sample. And D, it is recommended for accurate results. The answer is A, it may lead to erroneous results due to altered coagulant to blood ratio. Number 101. How often should a phlebotomist perform hand hygiene during phlebotomy procedures? A. Before and after each patient encounter. B. Only at the beginning of their shift. C. Only when their hands are visibly soiled. D. After removing gloves. The answer is A. Before and after each patient encounter. Number 102. Which of the following is essential to ensure the accuracy of a patient's laboratory results? A. Collecting an extra tube for verification. B. Proper patient identification. C. Using a large bore needle. Or D. Performing a blind stick. The answer is B. Proper patient identification. Number 103. When collecting a blood specimen from a central venous catheter, CVC, what must be done with the first few millimeters of blood? A. Discarded. B. Analyzed separately. C. Mixed with the rest of the specimen. Or D. Used for blood culture only. The answer is A. Discarded. Number 104. Which circumstances is it necessary to wear a mask during blood collection procedures? A. When drawing a blood culture. B. When the patient has a cough. C. Routine venipuncture. Or D. When handling blood specimens. The answer is A. When drawing a blood culture. Number 105. Which type of isolation precautions should be followed when performing phlebotomy on a patient with MRSA, methicillin-resistant Staphylococcus aureus? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. Or D. No special precautions required. The answer is B. Contact precautions. Number 106. What is the significance of the rubber sleeves on evacuated tubes? A. They maintain the vacuum. B. They prevent backflow of blood. C. They add extra weight for handling. Or D. They are there for aesthetic purposes only. The answer is A. They maintain the vacuum. Number 107. Which department would typically handle a complete blood count, CBC, test? A. Microbiology. B. Chemistry. C. Hematology. Or D. Serology. The answer is C. Hematology. Number 108. How should a blood specimen for a lipid profile be collected? A. In a fasting state. B. Immediately after a meal. C. Without any dietary restrictions. Or D. Only in the afternoon. The answer is A. In a fasting state. Number 109. What information should be provided on the laboratory requisition form? A. Patient's medical history. B. Phlebotomist personal observations. C. Test ordered, patient identification, and specimen type. Or D. Patient's medication schedule. The answer is C. Test ordered, patient identification, and specimen type. Number 110. Which color tube typically contains the additive EDTA? A. Red. B. Blue. C. Lavender. Or D. Gray. The answer is C. Lavender. Number 111. What is the proper procedure after a needle stick injury? A. Wash the area, report, and seek professional advice. B. Continue work and report later. C. Just wash the area thoroughly. And D. Ignore if there's no visible blood. The answer is A. Wash the area, report, and seek professional advice. Number 112. Which of the following tests require a 24-hour urine specimen? A. Urinalysis. B. Creatinine clearance. C. Urine culture. Or D. Pregnancy test. The answer is B. Creatinine clearance. Number 113. Which of the following is a venous condition that may impede blood flow during venipuncture? A. Thrombosis. B. Arteriosclerosis. C. Petechiae. Or D. Cyanosis. The answer is A. Thrombosis. Number 114. What does the term aseptic technique refer to in phlebotomy? A. using sterilized equipment only. B. Preventing contamination of the specimen. C. Drawing blood without causing pain. Or D. Proper identification procedures. The answer is B. Preventing contamination of the specimen. Number 115. When is the use of a winged infusion set, a butterfly, most appropriate? A. For patients with large, easily accessible veins. B. For obese patients. C. For elderly patients with fragile veins. Or D. For routine blood draws. The answer is C. For elderly patients with fragile veins. Number 116. For which test is it essential to maintain a strict aseptic technique during blood collection? A. Blood glucose. B. Blood culture. C. Hemoglobin. Or D. Cholesterol. The answer is B. Blood culture. Number 117. What is the proper order for putting on personal protective equipment, PPE? A. Gown, mask, gloves. B. Mask, gloves, gown. C. Gloves, gown, mask. Or D. Mask, gown, gloves. The answer is A. Gown, mask, gloves. Number 118. Which factor is most likely to affect the quality of a capillary blood specimen? A. The time of day the specimen is collected. B. The size of the lancet used. C. Whether the finger or heel is used for collection. Or D. Excessive squeezing or milking of the puncture site. The answer is D. Excessive squeezing or milking of the puncture site. Number 119. Which of the following is a critical safety concern when performing arterial punctures? A. Ensuring the site is properly cleaned. B. Applying pressure to the site post-puncture to prevent hemorrhage. C. Choosing the correct size of the needle. D. Wearing a lab coat. The answer is B. Applying pressure to the site post-puncture to prevent hemorrhage. Number 120. What is a primary reason for rejecting a blood specimen in the laboratory? A. The specimen was collected in the afternoon. B. Hemolysis. C. The specimen was transported in a biohazard bag. Or D. The use of a tourniquet during collection. The answer is B. Hemolysis.